hemiplegia. Hemiplegia means affecting one entire side. Here double hemiplegia, both sides, left arm and left leg, or right arm and right leg. But what is the difference between the hemiplegia and double hemiplegia? Here that is affecting only one entire side of the body. Here the both sides are affected, but one side is affected more than the another one. Next one, diagnosis. How to diagnose the cerebral palsy? From the symptoms, by seeing the symptoms or by examining the symptoms. So we will come to know the people have the problem of cerebral palsy. Next one, by taking brain scans. So by taking the brain scans, we can evaluate the areas of damage or irregular brain development. The brain scans, we can see the areas of damage or irregular brain development. Examples, MRI scan, then cranial, ultrasound cranial head, MRI, magnetic resonance imaging. Third one, electroencephalogram, EEG. That is the and the people will have fits. Already I explained, the people may have fits or seizures, epilepsy. In case of a seizures or epilepsy, EEG is used to record the electrical activity of brain. Next, by doing laboratory test, blood test, urine test and skin test, these are used to screen for genetic and metabolic conditions. Again, additional test. So they are having many problems: vision problem, hearing problem, speech problem, intellectual problem, development problem, movement problem, and other medical conditions. So for this, depending upon their problems, the tests are done to evaluate their problems. Next, treatment. There is no cure or no permanent treatment or permanent cure. There is no cure for cerebral palsy. The symptoms only can be controlled. So they require lifelong treatment or lifelong care with a healthcare team. They need lifelong treatment, but there is no cure. Treatment options: medications, therapies, surgical procedures, and other treatments. First one, medications. So these treatments are used to control only the symptoms, not to cure the cerebral palsy. First one, medications. First one, the medicines are used to treat the tightening of the muscles, specific muscles. Muscle or nerve injections are used to treat the tightening of specific muscles. Second one, oral muscle relaxant. Example, baclofen, diazepam. These are used to relax the muscle. So these are called as muscle relaxant, used to relax muscles. Next, medicines are used to reduce drooling. So injection Botox is given into the salivary glands to reduce the drooling. First one, medications. Second one, therapies. Under therapies, first one, physical therapy or physiotherapy. The muscles are trained, or muscle training programs and exercises are given to help their strength to gain their strength for flexibility, to gain balance, for motor development and mobility. Muscle training and exercises are given. These are helping these are helping the people with cerebral palsy to gain the strength for their flexibility of muscle, balance, motor development and mobility. Then occupational therapy. Occupational therapy is given to gain independence in daily activities as at home or school and in society or communities, to gain their independence in daily activities at home or school and in communities or in working places. Next treatment, next therapy is speech therapy and language therapy. The people are having the problems with the speech and intellectual problems. They have intellectual problems, speech problem and language problems. So the language therapy and speech therapy is given to improve their speech and their communication. Sometimes they are being taught to learn the sign language. Next, recreational therapies. Regular or adaptive recreational or competitive sports are given to improve their conditions. Example, therapeutic horse riding or skiing. First one we saw medication, second one therapies. Under therapies, physical therapy, occupational therapy, speech therapy, language therapy and recreational therapy. Third one, surgical procedures. The surgeries are done to improve their conditions. Orthopedic surgery to improve or to lengthen their muscles or tendons. Example, another one, selective dorsal rhizotomy. Here the nerve fibers are cut. Orthopedic surgery and second, selective dorsal rhizotomy to cut the nerve fibers. Other treatments, they have the problems with sleep, oral hygiene, feeding, nutrition, bladder, incontinence, vision and hearing. So for these all other treatments are given to treat these problems: sleeping problems, oral health problems, feeding problems, nutrition problem, bladder incontinence, bowel problem, vision problem and hearing problems. So sometimes they are treated with the cerebral palsy is managed with orthotic devices. The people are encouraged to use wheelchair, rolling walker and powered scooters.